Well, thank you, and thank you to the committee for the invitation to speak to you today. I'm going to talk about work we've been doing in the UK about how to evaluate interventions using a complex systems approach. So we need to develop research questions which take into account the wider contextual factors that influence an intervention. And we really need to encourage everyone involved in producing and using evidence, so researchers, funders, practitioners and policymakers, to develop, evaluate and implement whole systems. So this first example isn't directly a health example, it's just about street lighting. So in many of the local authorities, the city authorities in my country, there's a concern that too much money is being spent on keeping street lights burning all night. And there's also concern about the environmental impacts and energy usage. So it's been quite common in the UK for these local city authorities to say, well, we're going to turn off the street lights for 5 hours overnight, maybe from midnight to 5 AM or 1 AM to 6 AM. And that's a really simple intervention. That just means that the people who've got control of the switches just need to set the switches to turn off those times. And in terms of why they're doing that, where they're doing that to save money and they're doing that to save energy. So in that conceptualization, it's a simple intervention with a directly mapped outcome that's very predictable and certain. But is it really a simple intervention, or can we think about it as more of a complex intervention when we think about all the other impacts that might have? So for example, it may make people feel much less safe to go out on the streets. So you might actually find a lot of people who are going out in the evening are now scared to do so. So they're much more likely to stay at home or to make sure they get home before the street lights go out. You might find crime going up because more people are able to come out at night time and break into people's houses or break into people's cars in the dark and get away with that. It might also have an impact on the number of accidents. So it might be that people walking on the sidewalks are more likely to get hit or injured because the lights are not there. So this apparently simple intervention that's being conceived of by the people who have control over it, just as something simple, turn off the lights, save money, save energy, is actually having much bigger kind of system effects with some positive but also some negative health and social outcomes. So it's changing the way that social system is working within the areas. Another example closer to health is this UK soft drinks industry levy. And this was introduced a year or so ago in the United Kingdom, where the government increased the tax. They imposed a levy on soda and other drinks that had a very high sugar content. And you might just think about this in a very simplistic way, that by doing so, they would make high sugar drinks more expensive. This would reduce the demand and perhaps encourage some people to switch to low sugar drinks, sugar-free drinks, and that might have good impacts on health outcomes such as weight and obesity. However, for thinking of it in a very kind of linear way like that, the original kind of intention of the policy might have mainly focused on this kind of chain of events. But what might be the unintended consequence? Or might be, there may be a whole range of different kind of factors that are going on to feedback, emergence, substitution, a whole range of dynamic effects within the system that responds to the introduction of the sugar tax in ways that are perhaps slightly more difficult to predict, and other things that change over time, particularly the reduction in sugar in consumption and the reduction in weight that was intended from a health perspective. Our colleagues in the UK, a team led by Martin White, a colleague of mine, they went and did a complex systems map of this intervention. There were lots and lots of different factors that might influence how this increase in sugar tax would bring about any kind of desirable or undesirable change. And this was their system map. And we might look at that and think, well, that's very impressive because that helps us understand a complex kind of system of how the sugar tax might affect health. But actually it's way, way too complex for us to do a useful evaluation. But that's not necessarily right, because what they've then done is they've conducted a number of separate evaluations of different parts of that system, One of them was published fairly recently, so that's where they just focused very much on what happened to the products as a result, or perhaps in anticipation of the sugar tax. And they found very strong evidence that just because the sugar tax was being introduced, the manufacturers made a big change to the formulation of the drinks. They reduced the sugar content of most of the high sugar drinks, which meant that they weren't liable for the tax, and therefore the price of drinks didn't change a great deal, but what did change was sugar content. So this is an example of how the focus of evaluation and the evaluation questions that are being asked are being changed by taking that systems context into account and seeing the feedback from the impending introduction of the sugar tax actually feeding back to the formulation of the product. They did some systems mapping and identified all of these different things that could be affected by, but also influence the effects that sugar tax. Third example, so this is an example of a really truly complex systems intervention, and this is community development kind of intervention approaches, community-based participatory intervention, as it may be called in America, where you actually introduce a set of processes in which you go through in each of your communities to try and identify key stakeholders, identify their priorities, develop a trust amongst that group, and identify the key actions that can be taken forward in partnership by that group of stakeholders who are working together to bring about change. It means you have real ownership of the community and key organisations in the community in what they're doing, and that any change that comes about is embedded and sustained. So it's a real kind of systems approach, a systemic approach to intervening. To evaluate that and to take it forward successfully, you have to be very kind of flexible, and you have to recognise that there will be continual adaptation. The initial outcomes you're targeting might change as the programme develops and different people become involved. And exactly what is delivered on the ground and the outcomes that are achieved are quite emergent through this way of working, through this very adaptive way, flexible way of working. Finally, just going back to some of the guidance we've been producing recently and thinking about what this means for how we go about thinking about designing our evaluations of systems interventions. Firstly, I think it's important to identify there are different approaches to evaluation, and the traditional approaches of efficacy and effectiveness may still be the best ways of going about evaluation for certain types of research question. So if we have a fairly simple or complicated intervention, and we firstly want to establish whether it works in ideal circumstances, then do a standard efficacy trial or effectiveness trial. That's fine, that's still going to be useful. But also there are other approaches. There are more theory-based approaches and also systems-based approaches that really address different questions, and they're much more questions that relate to real-world effectiveness and really looking at the question, not just does this work, is it effective, yes or no, but really does this contribute to changing the system in a positive way? The first thing that guidance does is identify that there are a number of approaches to evaluation, and it's perfectly reasonable that in some cases we still focus on identifying efficacy and then more pragmatic real-world effectiveness. So I'm still focusing on questions and designs that try to say, does this intervention work? But equally, as we're more aware of complexity and therefore the shortcomings of that kind of evidence that's more suitable for simple or complicated interventions, we might take more theory-based approaches, or we might take more complex systems approach to our research. And so a simple intervention could be evaluated using in an efficacy trial or an effectiveness trial, but a bit like the street lighting, we could broaden our kind of understanding of the effects that simple intervention might have and use a theory-based, realist or complex systems type of approach to evaluation. And certainly as we move over into the right-hand column where we have a complex adaptive intervention, that's going to be very difficult to evaluate using an efficacy approach. It's much more likely we'll need to use a complex systems approach to evaluate that, to really capture everything that's going on. And finally, this is the diagram that we're pinning our updated evidence around. It identifies 4 stages of research. It identifies that when we are developing an intervention, often we're not just developing researcher-led interventions, but we're identifying interventions that are perhaps policies or changes in practice which governments or health authorities are bringing into place anyway. And so we as researchers are not developing the intervention, but we want to evaluate the intervention to see what kind of difference it makes. We then might do some feasibility work, evaluation work, and implementation work. But this diagram doesn't have arrows going from each of those stages to each other, but says that when we're doing each of those stages of research and before we move on to another stage, we must check out these 6 core elements in the middle of the diagram. And this is really saying we need to consider context. We can't just think about the intervention. We need to think about the context, the wider system, in terms of thinking about how we evaluate and how we conceive of thinking about how the intervention is going to bring about change. We should develop, refine, and continually retest our theory about how the programme will produce outcomes. And we need to do that with wider stakeholders. We need to not just do that as academic groups, but we need to involve the people, but also the different kind of professionals and policymakers and stakeholders who have responsibility and knowledge about the context within which interventions are going to be implemented. And also at each of these stages, we need to identify the key uncertainties. There will always be new things coming up, new questions coming up, and we must focus our research on the key uncertainties and not just still try to answer the effectiveness question without answering some of the other important questions that will be just as relevant. And then we must also use our data that we're collecting to continually refine the intervention. Standard trial methods go against that. You need to fix the intervention and the comparator and then evaluate that and not really change it. We need to recognise that as we collect data that suggests the intervention isn't really working as we expected, we need to refine it. And then the other element, not directly relevant to complexity, is always to think about economic considerations, because at the end of the day, decision makers need to know where best to put scarce resources. So we should not only be looking at outcomes and understanding the system, but also understanding the different kind of costs and benefits of different alternative ways of intervening.